Hello everyone, my name is Dr. Jacob Amner and I will be answering some questions today about the crowns and all the procedures that are required for that. Dental crowns are the type of dental restorations that protect the whole tooth. If the tooth has sustained damage or had some treatment as a root canal, the crown usually placed on the tooth and it resembles the size and shape of the regular tooth that it was before, and something that patient can use, function, and smile. The alternative to dental crowns could be onlays or veneers, but it all depends on how much of the tooth structure is missing. The veneers are usually cover half of the tooth, onlays could cover 3/4 of the tooth, and the crown covers the whole tooth. There are multiple types of the crowns that we can use. All of them in the end resemble the actual tooth structure. There could be metal crowns with the porcelain veneer on top of them. There could be zirconium crowns, there could be porcelain crowns. The point I'm just trying to make is that all the crowns is doing is protecting your tooth, and in the end it's a completely aesthetic and cosmetic product that you receive in the end that feels completely natural in your mouth. So there are different types of material that can be used on the crowns, but the major point is that they all in the end resemble the natural tooth structure and the color that the patient has. Just to throw some names in there, it could be porcelain crown, it could be IMEX, bisilicate, or zirconium crowns. They all be done based on the patient needs and the requirements. Most of the time, yes, we place the crowns to avoid any damage in the future. The sole purpose of the crown is to protect the tooth. It serves as a helmet. Sometimes we don't place the crowns if the tooth didn't sustain a lot of the damage and most of the tooth structure is still there. Alternative might be recommended, such as an onlay, which is 1/4 of the crown. The dental crown procedure is a very easy process. It could be a one-day process. When we prepare the tooth, the same way as we prepare for the fillings, we scan the tooth and we have a machine that mills the crown in the office, and we place it cemented the same day, and the patient can go and have this crown done in one visit. Sometimes it takes maybe multiple visits, depends on the amount of work that is required. So at that time we either scan it after preparation or we take the impressions and we send it to the laboratory. When the laboratory makes, based on all that information received, make the products for you, and then on the second visit you're getting the product delivered. Most of the time when we deliver the crowns or when we're preparing the tooth, it's all done under local anesthesia, and it's a very easy process to go through, and patients are very compliant with this procedure and usually take it really well. The consequences of getting the crown or not getting the crown is a very good question, and again, it depends on the individual situations. When things are done properly, when everything is prepared properly and delivered properly, by analyzing your patient's bite, the crown can serve you for a very long time. And by not placing the crown on the tooth that's needed, then you're in danger. Then there's a high chances of breaking it, and there's statistics that can back this up, and the tooth becomes after that hopeless, and we have to think of alternative treatments such as taking the tooth out, implants, but it's a completely different discussion. I hope I answered most of your questions, but if you have more questions, I will be more than happy to answer them, and you can call us at 718-275-7300 at Great Smiles of New York, and you can request a visit where we can have a session together and we can go step by step to answer all your questions. And thank you for listening.